what are the ways that you can support your own mental health by addressing those experiences that are traumatic and
Mhm.
learning methods for not allowing them to traumatize you in every encounter that you have. Like there's work to be done over time to minimize the effect of those experiences, but you have to know what they are.
Yeah. Yeah, I love that. So basically being empowered, empowering yourself and knowing that you can find support and you can do something to support your own mental health. And of course, if you can't do it on your own, that's where the therapy and treatment is for. But I love that what you implied there because it's empowerment, it's being resilient and knowing that even despite your trauma and everything you've been through, you can get through this and come out on the other side stronger. Welcome to Journey to Joy Live, a podcast to promote wellness, resilience, and joy while providing mental health awareness and breaking down the stigma of mental illness in the Black community. I'm your host, Dr. Joy, and today I bring to you episode 49, Joy Unleashed, Breaking Barriers in Black Mental Health. And I'm excited that I have this very special guest, Dr. Tami Benton. What is she not? She is professor, child and adolescent psychiatrist, psychiatrist in chief, chair of the Department of Child and Adolescent Psychiatry at the Children's Hospital of Philadelphia. She's the president of the American Academy of Child and Adolescent Psychiatrists, as well as president of the American Association of Directors in Child Adolescent Psychiatry. Have I missed anything, Dr. Benton?
No, I don't think so. I think you captured the high points. Thank you.
Sounds like you're doing a lot. And thank you so much for coming on and being my special guest on Journey to Joy Live.
Thank you for having me. I'm really excited about being here.
Course, really appreciate it. So as we talk about breaking barriers in Black mental health, let's talk about your personal ability to break barriers. I mean, think about it. Black, female, in psychiatry, leadership. What's your inspiration? How did you get to where you are now?
Wow, it's been such a long time. I'd have to reflect quite a bit. But now I've been so I think interestingly, at the time I started my medical school journey, there was just a couple of things I was sure about. One was that I did not want to do psychiatry,
Mhm.
and that I did not want to work with children. Okay, and I don't think at the time I started medical school, I didn't know what child psychiatry was. I
Mhm.
didn't know it existed as a specialty. And the only things I knew about psychiatry is that, yeah, that it didn't happen to Black people.
Mm.
It didn't happen in our community. And I didn't know anyone who had mental illness. And so that was sort of my perspective as I was growing up, which I think is not all that unfamiliar.
Yeah.
And then I think as I progressed through medical education, interestingly, I think I learned much more about the stigma of mental illness. And too often, the psychiatry programs were relegated to off-site locations.
Mm.
They were not, psychiatry was a required rotation, but child psychiatry wasn't.
Mm-mm.
And so it's just purely by chance that I had an introduction to child psychiatry. And it happened that that person, my very first clinical rotation in child psychiatry was with the woman who went on to become my mentor.
Mhm.
And it was interesting because my first rotation was in her clinic, and her clinic focused on children who had lost parents. And she was interviewing a 5 and a 7-year old. It was the first time I'd
Mm.
had ever observed a psychiatric interview. And I was struck by the fact that there was a field within medicine that
Mhm.
really could change the future outcomes for young people, and I think it resonated so much with me because I lost my own mother at 7, and my
Mm.
brother was 5,
Mm.
and at that I think it was the first time I'd ever heard adults talk to children about loss, and, when I remember when my mother passed away, it was a lot of, positive feedback for being brave and kind of soldiering through. And people, many around that time in psychiatry, there was this thinking that
Mhm.
um, children didn't really experience grief in the way that adults did.
Mm.
And so we know that's changed a lot since
Yeah.
then from that psychoanalytic framework. But it was the first time that I realized that there was a space in medicine where you could actually do more preventive work,
Mhm.
and so through medical school, I kind of struggled with this whole idea of was I going to do pediatrics or was I going to do child psychiatry? Because I felt like neither specialty fully captured children's needs and
Mhm.
children's overall health. And so I ended up doing both. I ended up doing the triple board program, which was a pilot program at that time.
Ah,
And so I studied pediatrics and child psychiatry, and I was more convinced after that that neither specialty alone capture
right.
what children need for normal, healthy development. And so I did the triple board program
Mhm.
and decided that I wanted to work in a children's hospital because that's where the children were, right? I
Uh-huh.
didn't realize at the time the children actually more of the children are in communities,
Yes, of
but more of
course.
the children who are ill are in children's hospitals. So I've actually spent my career in children's hospitals. So my you know my I moved to Chicago after I finished my fellowships. I did my
Mhm.
fellowship in New York City at Einstein Montefiore. And at the time, it was so balanced because it was Albert Einstein, Montefiore, North Central Bronx Hospital, and Jacobi. So Health and Hospitals Corporation provided you with like a broad exposure to kids
Mhm.
across the continuum.
Mhm.
And I was there during the height of the pediatric HIV epidemic. And that really influenced my career choices after that. Um, Once I finished my training, I moved to Chicago and I was at what's now Lurie Children's for about 4 years. And then
Gotcha.
I moved to Philly and once I got to Philly,
Mhm.
it really allowed me to work with minoritized populations that were heavily impacted by medical conditions and the mental health challenges that are associated with those. So I started to work with kids who had sickle cell disease and
Mm.
kids who were HIV
Ah, that
positive.
makes sense.
Yeah, and so that's sort of how my career interest started. But it all came together because I had the experience of recognizing that children aren't just the physical illness that they have, and they're not just the mental illnesses that they have, but they have the capacity to be all the things they want to be with the right support from their families and
Mhm.
communities and their care teams.
Wow, thank you for taking me through that. And you know what? I didn't realize you did the triple board program. I actually was at Cincinnati Children's for triple board back in 2013. I did 3.5 years. I really wanted to do it, but then once it hit, and I think I finished outpatient, a year of outpatient psychiatry, and then went to inpatient pediatrics. And I says, you know what?
Yeah.
That mental change. So I ended up switching from triple board at that time to the, categorical psych and ended child fellowship, but
Well,
yeah.
I'm glad about that because I will say that early on, there was, the whole pediatric experience was mostly focused on intensive care
Mhm.
experiences, and it doesn't feel all that connected to the work that you will ultimately do. I mean, I think that at the
Yeah.
time, you know how it is once you do medical training, like you're just following a pathway.
Yeah.
Um, and I was just following my pathway, and
Right.
it was during the days that it was still a pilot program, so we were still
Mm.
kind of working through it. But I'm glad I did it ultimately. Although
Mhm.
I think I would have been glad if I'd just done child psychiatry training too. But what I do know is that you know, the way pediatric training was happening at that time, there was so little mental health integrated. That's
Mhm.
changing. I
Mhm.
mean, that's changing, but that really was a kind of a turnoff in terms of thinking about all the things that children need. Like their emotional health is just as important as their physical health.
Mhm.
They're one and the same.
Right.
And at the time, I don't think there was a real appreciation for that.
Yeah, yeah. So you kind of alluded to stigma as you were telling your story about mental health, like being non-existent in our community and just in general, just this big stigma. It's huge. How do you think stigma's changed over the years and how has it changed, what it looks like and how we address it? Like, have you seen any changes? Are we just still in the same place?
I don't think we're in the same place, but I think change is slow.
Yeah.
But I think change is happening, and
Yeah.
I think it's generational.
Mhm.
I think it's in pockets that we don't necessarily pay attention to. So, for example, I find that younger people are much more open to the idea of their own mental wellness and their mental
Mhm.
health.
Mhm.
And they're able to use terms like anxiety and depression, and I see more of them. I think, among people that are younger than me, which is I think now includes most of the population, uh, I
Yeah.
just a lot of folks have really started to open up and have more conversations, and I'm glad to see it among high school and college students. I also see it in other communities, so I see more discussion about mental health and more willingness to support mental health in faith-based communities.
Mm.
And that has been quite a pleasure.
Yes.
Um, I've been able to, start to do more work with faith-based communities around suicide prevention.
Mhm.
Okay, and it's just been amazing to me how much willingness there is to learn about addressing the mental health of, their congregants. And
Yeah.
in addition, they, it's amazing to me how willing people are to be open to their spiritual leaders about what they're struggling with and how to get help.
Mhm.
And so I think for the Black community, the churches have been a place where, folks are destigmatizing mental illness
Mhm.
and normalizing mental health.
Normalizing mental health. Yes, being comfortable talking about uncomfortable things, normalizing it, making sure it's okay to talk about how we're feeling. And that's the thing with the religious community, them being open to, we can pray to God, we can believe in God, we can have our faith, but also when it's needed to seek help because all of it's needed, right? So
Yeah.
that's really good and important and the transparency for us to be able to feel comfortable talking about ourselves. Love it.
Yeah, so
Love it.
I also think, one of the things that I've really appreciated is
Yeah.
how much more discussion about mental health we're seeing in schools
Mm.
and other places where young people are every day.
Mhm.
And the only way we're going to get on top of this, all of what's happening, because there's so many things that are happening disproportionately in
Mhm.
minoritized communities, particularly Black communities.
Mhm.
And the only way that we're going to be able to address those things is by making sure that mental health care is accessible in all the places that young people are. So that means that, for psychiatrists and psychologists and social work therapists or whatever kind of therapist you are, you're going to have to get out of your office and be a little more community connected,
Mhm.
where kids are in their
Right.
recreation centers, with their coaches, in their churches, in their schools.
Mhm.
Um, that is going to be the only way that we're going to be able to start to address what's happening in our communities, which are
Mhm.
more vulnerable to the impacts of, all kinds of negative things that impact your mental health.
Mhm.
And we know that so many of the things that contribute to the poor mental health for young people and families are social factors and social determinants.
Yes.
And the only way for us to address those is to be in those places where those social factors have impact, which is home, schools, communities, and every place else that kids are. So
For
I
sure.
think I think that's going to be how we have to approach this.
Yes, yes, yes. You said a lot, but so you said we need to get out of the hospital, we need to get out of our offices. Basically, we're able to address people one by one, but if we can get out and advocate, join community organizations and be there. And that's exactly why I'm doing this podcast. And I see a lot of therapists out there doing podcasts and talking and addressing and educating and making awareness. So it's definitely really important to reach our community as best as we can so they can say, oh, yeah. First of all, Black psychiatrists exist. Second of all, oh, they're human. And third of all, oh, let me go see one because I need some help. And then also, you mentioned just in general, just being there and having a presence. So that's definitely important. My question for you, so myths. There's a lot of myths when it comes to mental health, especially with, "Oh, I'm weak. It's a sign of weakness if I talk about my mental illness or that I'm sad," or for Black men, if I cry. What are some big myths that you've, come across with your patients in mental health in general in the Black community, and how can we use our platforms to bust those myths?
Yeah, I think I mean, that's a really good question. I think the myths that I come up against most commonly is that um, these are white people's illnesses. Um, Black people got real problems, white people don't. And so things like depression don't exist for us because we have other things. And I think we've all fallen victim to that.
Yeah.
Um, but I think I think the myths exist around what's happening in our heads and in our lives and our tendency to blame ourselves when we can't fix it.
Mhm.
You're surrounded by people who tell you all the time that what you're feeling is not a problem. So the
Right.
fact that you are experiencing depression or the fact that you're experiencing extreme anxiety or the fact you're experiencing trauma is just bear it and move on, right?
Exactly.
And then I don't think people know that there are solutions, which is the other problem, right? So
Right.
if you're used to feeling depressed and anxious and traumatized, and folks tell you just work through it, soldier
Mhm.
on, and you never know that there are solutions, that
Mhm.
you actually don't have to feel this way. I think one of the biggest myths is you have to feel this way, and that
Right.
that's kinda normal. And that if you tell people that you can't change it, or you can't do everything you need to do while you're struggling with these feelings, it is a sign of character weakness, and in some communities, just not having enough faith. So there's something wrong with you.
Mm.
And then, part of that is I think it has to do with education of the listeners, not just the education of
Mm.
those who are having the experience. And so, I have always assumed that feeling anxious about most things is just normal, right? And but you don't recognize that the level of stress that can be associated with
Yeah.
extreme anxiety is not normal. But not just that, even if you're anxious enough that it's causing you some distress, it's actually pretty easy to fix that or address that. And so I think the ignorance is about recognition, about attribution. What does it actually mean? And about solutions. Okay. And there's this idea I find most often among Black people, that and I've been guilty of thinking this myself. Like I said, I didn't even believe mental illness was real for Black people. I thought it was like white people.
Mm.
White people experience that. Um,
Mm.
you just don't realize that you actually don't have to feel that way, and that it's part of your overall health, and that you should be treated because it's part of your health. And I think that
Wow.
really has not permeated the mainstream.
Yeah, and it's really good for you to mention that you at one point felt that way too, because if you felt that way, other people have felt that way, that it's a white people illness, but it's a everybody illness, all genders, all races.
Yeah, well, no, that's true, but I think that stigma's still out there, okay? I mean, I think
Mhm,
there
for
are a lot of
sure.
people that still believe that, and the reality is we don't have to suffer in silence, okay? There are things we can do. They don't, and then there's the whole issues around trust of what the mental health system is gonna
Yes,
do anyway.
yes.
Okay, and but there has to be people out there who look like us, who are telling people what the treatments actually are.
Yeah.
For most things that folks are experiencing, the treatments are not invasive. Okay. They're not things that can cause you harm. I mean, psychotherapy works when it's
Mhm,
executed properly.
mhm,
Medications work when they're executed properly.
mhm.
Family-based interventions work. School-based interventions. There are lots of things that people can get to support their mental health that's not invasive. It's not all ECT. Okay. And it's not all things that will harm you. So I think
Yeah.
there's still this distrust. There's still a lot of providers who are not very culturally competent,
Mm,
and don't understand, how to learn about their patients, and
right.
how to demonstrate genuine humility in their interaction with patients. And so I think that's going to be some of the work. I mean, we'll be able to diversify the workforce. We're working on that. I think that adds, so many benefits for a variety of reasons,
Mhm,
but it's not always going to be the case that there's cultural or racial, ethnic matching of
mhm.
providers with patients, nor does that necessarily need to happen. But it definitely does need to happen that there are others in the environment that can
Right.
educate those people who are not in the same ethnic, racial, or cultural
Exactly.
background.
Yes, we need to educate our providers and educate the public. So it's just a all around education for sure. And what I meant to mention earlier, because you mentioned social determinants of health. For those who don't know what those are, can you explain a little bit more about what that is?
Yeah, the social determinants of health, and we've been talking so much more about social determinants as if we didn't know things like trauma, poverty, hunger, bad neighborhoods made people sick. Um, those really are the factors. I mean, it's the
Yeah.
adverse environmental factors that impact health overall. They impact your
Mhm.
physical health and your emotional health. So we talk about social determinants. We talk about income, neighborhoods, neighborhood violence, racism, other factors that are traumatic for people, for human beings, war, disaster,
Yep.
all of those things. And living in impoverished communities where there's no green space, there's no access to markets where you can get fresh food, all those things determine health outcomes, but they also determine mental health outcomes. Okay. And we interestingly, in the past, we frequently did not talk about those factors impacting mental health. And
Yeah,
we also know that for minoritized populations, they're overrepresented among those people who have sort of have more negative impacts of the social environment around us. And so essentially, we're starting to pay a little more attention to that, because of the impact it can have on mental health long term as well as physical health.
for sure, for sure. Yeah, it's very important. As you mentioned, aversive environmental effects that affect our mental health. You know, with Black people, there's a lot of trauma. There's generational trauma, there's the systemic trauma, slavery, systemic racism, discrimination, what we see happening in the news. There's a lot happening. And I know there's no real answer right now, but, are you able to break down for us how this has seeped into mental health care and what do you think the biggest steps that we need to do to fix this?
Yeah, well, how to fix it's a big question. I'm going to count
Yeah.
on you and so many others for us to be able
Right.
to craft some solutions. But I mean, one of the first things is being able to help people understand the impact of traumas and where they come from and the
Mhm.
multiple different ways that we experience them. And one of the more common ones is the whole experience of microaggressions. And
Yeah.
I mean, and I think sometimes people interpret those daily slights as minor, but they impact your overall well-being over time because they trigger physical reactions, physiologic reactions, and emotional reactions. And in so many environments,
Mhm.
I think when we think about racial trauma, we just think about some one big major event as opposed
Mhm.
to there's all the small events. Maybe there's a major event, but there's all the things you see around you every day that affects other people that are traumatizing as well. And,
Right.
the recurrent trauma or the negative events or hurtful events over time does tend to eat away at your mental health.
Yeah.
One of the first steps is one, recognizing the impacts of trauma on everybody. So,
Mhm.
trauma is not good for your physical or your mental health. And
Yeah.
over time, it impairs your mental and physical health. The first step is identifying it.
Mhm.
Okay, and understanding its potential impacts. And, a lot of focus has been on, as you know, the adverse childhood experiences or
Mhm.
ACEs. But even just, the ACEs screens that are being implemented in the primary care setting can be helpful in identifying experiences that, people have had that are traumatic and
Mhm.
adversely impacts their overall well-being and to be able to get some support for addressing them. And the support doesn't always mean that you're in weekly psychotherapy. I mean, it doesn't
Right.
always mean that. But it does mean that one, recognition, and then what are the ways that you can support your own mental health by addressing those experiences that are traumatic and
Mhm.
learning methods for not allowing them to traumatize you in every encounter that you have. Like there's work to be done over time to minimize the effect of those experiences, but you have to know what they are.
Yeah. Yeah, I love that. So basically being empowered, empowering yourself and knowing that you can find support and you can do something to support your own mental health. And of course, if you can't do it on your own, that's where the therapy and treatment is for. But I love that what you implied there because it's empowerment, it's being resilient and knowing that even despite your trauma and everything you've been through, you can get through this and come out on the other side stronger. That's what I believe.
Yeah, and I also think it's helpful. Like we're doing a lot of trauma-informed care work
Mhm.
with teachers and other places where kids are with faith-based communities, with the police departments.
Yeah.
We're doing a
Mhm.
lot of work with all those folks so that they can understand. And I've been pleasantly surprised, I have to say. People challenge my negative thoughts all the time. But I had an experience probably about a year ago
Mhm.
with a youngster who was assigned to be in our clinic who had experienced an incident at school where someone shot him.
Mm.
And he survived that, had been
Mhm.
hospitalized.
Mhm.
And I think while he was hospitalized, he received some mental health support while he was in the hospital.
Okay.
But after that, he never did. And
Oh.
then, he was scheduled for follow-up appointments and didn't come. And so I just, I was working with my fellows. And it was like, okay, so, well, I don't have to do anything because the patient never came. I was like, well, no, there's some things you can do. So let's contact the kid had like a parole officer, someone who was involved, a social worker, or someone who was involved in their lives. And my fellow called and said, this youngster did not show up for an appointment. And, it was interesting because it was I think it might have been a probation or parole officer, I'm not sure which one it was, said to us,
Mm.
I would imagine not. It was such a traumatic experience for that youngster that the whole idea of coming in and having to retell that story
Oh.
was probably enough to discourage that person from coming in. And
Oh.
we were both flabbergasted.
Yeah.
Um, but it was because we didn't expect to hear that from the person we were hearing it
Mhm.
from,
Yeah.
and I was so appreciative of the fact
Mm.
that that person had that officer had some trauma-informed training and talked about
Yeah.
what they could do to support this young person as opposed to, criticizing them or blaming them or
Mm.
just saying, "Well, he's gonna be in trouble because they didn't show up," but instead really just understood
He
that the
understood.
experience of trauma creates changes your behavior, and that the trauma is ongoing. And I thought, wow, that really just highlights the fact that it really is going to take a village if we're going to address the mental health concerns of young people.
A
And that was
whole
really
village.
inspiring.
That is good that he kinda understood from the trauma-informed aspect, and that brings into the other issue is that how do we get people to come in when they're experiencing trauma? Because I have people tell me all the time, they might be seeing me for medication management only, and they're not in therapy because 'cause they're like, "I don't wanna talk about that, that's gonna bring all the issues back that I'm experiencing." I try to tell them that, especially with post-traumatic stress disorder, the more you talk about it, or when you first talk about it, of course, it's gonna bring out the symptoms. It's ripping open that wound, but that's the point, is for you to deal with it, process it, work through it. But, how do we get people to come in? And, of course, the second part of that is how can family get people to come in? Because that's a whole whole 'nother issue as well.
Yeah, it is. And I think that, I mean, I think it kind of goes back to some of the issues around multiple sources of support.
Mhm.
And so there's so much work we're going to be able to do in our offices and our practices.
Right.
But the rest of it's really going to have to be building a community of carers around young
Yeah.
people. And it's how do you educate their families about their needs and how to have these conversations? How do you learn from other young people? Because I have found them to be extremely helpful in thinking through how you have these conversations with young people.
Mhm.
And so, I think one of the things that we need to think about as a community is how do we provide a community of carers and give people the tools that they need. So, for example, one of my staff just got trained as a mental health first aid trainer.
Okay.
And we did that because we've decided that we're going to go out and train people in the community. We're going to offer it as a free service. Our clinics after hours, we have lots of space. Anybody who wants to come in and learn mental health first aid, and we're doing mental health first aid training for teens in the community.
Yeah.
Yeah, and what we want is to give them the tools to be able to ask the questions and to provide the support. And then we're also looking at, how we can establish a community worker program.
Mhm.
If we want people to stay in their communities and support the people they care about,
Yeah.
we need to give them some tools to be able to do that. And so we're looking at thinking about our partners
Uh-huh.
differently. And what can community partnerships look like? For us, in our work as psychiatrists,
Mhm.
a lot of times you just sort of I have found myself feeling like the burden falls on me. So if I'm in the
Yeah.
emergency department and I see a youngster and the kid actually is really not the problem. It's all the other factors around them that's the
Yep.
problem. And and then, if child welfare is involved or someone else is involved, they don't have a place for the child to go. I mean, it's just you just feel overwhelmed because you feel like you can't do what you need to do for that child. But I think once I really understood that the only solution was to strengthen our partnerships with the people who
Mhm.
have relationships and responsibilities for young people, that together we can come up with solutions.
Mm.
But it's going to require education because, sometimes I talk to those folks, you talk to the case managers, you talk to the teachers, they don't know what's going on, they don't
Yeah.
understand what's going on, they don't necessarily see us as resources to help them understand what's going on, and I think
Sure.
yeah, and I think because these systems disproportionately impact Black children, we
Mhm.
have to be in those places, and we have to
Yes.
work with those folks and
Yes.
teach them the basic mental health things they need to know.
For sure. That's thank you so much. So I'm curious about success stories because I was going to mention if there were any unique mental health initiatives, that you felt were making a difference. You mentioned the mental health first aid training, which is awesome. The community worker program, of course, strengthening our partnerships. But any initiatives that you know about that have been successful that you firsthand were involved with or that you've seen?
Yeah, so we've had some pretty successful initiatives here in Philadelphia. I think we've had quite a few. I think
Mm.
one of the successes that I feel most proud of is our
Hmm.
community partnerships around suicide prevention in Philadelphia.
Okay.
So, we have probably in a very focused way since about 2015 started to work more closely together. All of the academic centers and all of the community organizations who are concerned about suicide prevention, we
Yeah.
started to have a regular town hall meeting twice a year.
Okay.
We started by hosting it here at my organization, my hospital, the Children's Hospital, and
Hmm.
we pulled in all of the other academic centers. So it was Penn, Chop, Jefferson, Drexel, all of us, and then eventually we pulled in the schools, we
Okay.
pulled in recreation centers, and we started having a really twice a year, what we call the suicide prevention town hall. And it really was all of us together focused on an important issue for the city. And from that, so much has grown. I mean, the suicide rates have been up and down, but it's really been a way to engage the
Yeah.
entire community in thinking about a problem that was impacting all of us. The suicide prevention activities in schools,
Mhm.
in community centers,
Mhm.
have really increased, and then the Philadelphia Suicide
Good.
Prevention Task Force sort of reconstituted themselves to pull in more community members, and so that has really been, one example. I mean, Department of Behavioral Health and Intellectual Disability Services, all of those folks have really come together to address suicide prevention in
Ah.
Philadelphia, and that was one of the projects that I feel proud of something
Oh.
we've accomplished together since 2015, and it's getting better every day with all the other people who are doing really interesting work. The other thing, that we've done recently I really been pleased with is we established a partnership with the school,
Mhm.
in Philadelphia called Girard College.
Mhm.
And Girard College is an interesting program. I think the school was established like in the early 1900s. It was a school established for orphans at the time. And I think at the time the school was established, it was only for like no minority children could participate. So it was just white kids.
Mm. Mm.
And that school starts at 3rd grade through high school, and, kids live there during the year, and if their family's in Philadelphia, they may go home in the
Mhm.
summer or other times. And then, of course, that all changed, over time. It wasn't just white kids anymore. Now the school is predominantly minority kids. They have like
Oh.
a 99% college attendance rate over at
Oh.
Girard College. But we established a few years ago, their president, Lorena Burks Marshall, president of
Uh-huh.
the Foundation for Independence Blue Cross,
Mhm.
um, gave us some funding to start a mental health partnership with the school.
Ooh.
So we provide what they need. They have some on-site services they provide for themselves, but the partnership allows them to access the services that they want and need. So it's a real partnership, and we've been able to provide the mental health support for that school in a way that's been rewarding,
Mhm.
increases the skills of the kids and the staff, and has allowed us to form a nice partnership where psychiatry services are appropriately utilized. And so when things come up, it's a partnership around how we work together and how we support each other. And the outcomes so far have actually been pretty good with that project. So that's been
Oh,
such a
that's
nice
nice.
example of how we can
Yeah.
work together.
Yeah, partnerships with schools are key because that's where our kids are, finding them where they are. And I imagine it increases or reduces the no-show rate because if they're coming into clinic, then it's like, okay, parents have to go pick them up and that kind of thing. But if they're right there with the school, and I'm also thinking about Chris 180. So I'm at Chris 180. I'm chief medical officer there. It's a community mental health center. And we have a large school-based mental health program. And it's really great because the counselor or therapist just goes right in and gets them out of the classroom and is able to see them for their session. So partnerships with schools is keys. Yeah.
And you know, the framing for this program I think is really good. It's called the school success program. And so it's
Mm,
not, I mean, it's not about this is your psychiatric treatment program. This is
right.
about how do we support you in being successful in schools and during the time that you're developing and providing you with the tools that will assure that you are successful for the remainder of your life. And so, you know, and it's a different framing for how we
Mhm,
think about mental health. And if we could just really articulate our message in a different way.
mhm.
Mental health and treatment for mental illness is all about supporting your ability to live your fullest life. That's what it's all about.
Yeah.
And we come into that with different physical and different mental, emotional, intellectual strengths. And the goal is to maximize all of those things so you can reach your full potential. And that's what mental health is really all about. And
Right,
that's a
right.
different framing.
Yeah, and just in thinking about this, I'm thinking about many patients that feel like they have to choose between their mental health and their physical health when it comes to some of our medications. Bipolar medications, schizophrenic medications that are antipsychotics can increase the risk to certain medical issues. So then, there's patients they're like, "Well, I don't want to gain weight, so I'm not going to take this medication. I don't want to get diabetes. I don't want." So how do we talk to our patients about balancing those 2 and definitely making sure they talk to the psychiatrist before stopping their medications.
Yeah, I think having conversations with our patients about how we're going to partner with them to minimize those outcomes,
Yeah.
and to be candid with you, that is really I find most of the time what it's all about.
Yeah.
You know, so it is not the case that every one of my patients who's on an antipsychotic
Right.
must gain weight. That doesn't happen. But you have to have those conversations.
Mhm.
And folks need to know that you're their partner in addressing all those things because those
Partner.
things are important for their overall health. So if in fact your patient's gaining weight, because believe me, I've seen the opposite where nobody's paying attention. And, you
Yep.
know, so the reality is that we know which medications have the potential for weight gain.
Mhm.
And we know how to talk to families about what to do about that, right? Because it's not just the medications. When you start talking about your mental health, it
Yep.
is your nutrition, it's exercise, it's your activities, it's all the other things that you do. And we need to start counseling our patients with
Mhm.
all those things in mind and making sure they have the supports that they need for their overall health. And I think that's the key, and
Yep.
we you know, doctors need to make sure they monitor those things,
Mhm.
and you can't watch your patient gain 50 pounds and say, "Okay, yeah, well, that just happens." I
Completely.
mean, like, and sometimes that is what happens.
Right. Yeah, it can happen. So it's very true that so education, collaborating with the patient, us psychiatrists aren't just telling you what to do. You take into account your wishes. That's for
Or
sure. Yeah.
prioritizing your needs and your
Mhm.
priorities. Okay, I think
Exactly.
that's the key, and that's a change, okay, because previously, physicians tell patients what to do.
Correct.
As opposed to what's important to you. Okay,
Mhm.
those are the things that we need to focus on supporting, and we can do that. We know how to do that. Okay, but
Mhm.
I think it's a change in how we think about care, driven by
Yeah.
factors that I think are beyond our control. Quite frankly, it's not that
Mhm.
physicians don't want to do that. It's just the way systems are structured and reimbursement is structured, and the time you have
The
to do
time.
what you can.
Yeah. You may feel like you don't have enough time. It's like the patient feels rushed and all that. Oh, yeah. Ooh. Now, what's one thing you wish every Black individual knew about their mental health that could actually potentially change their life?
That your mental health is as important as your physical health, and that at the end of the day, you should be able to get up every day feeling pretty good.
Yeah.
And, you know, if it's depression, if it's anxiety, if it's excessive stress, it's
Mhm.
important. It's important to address it. Whether you address it with your healthcare provider, whether you address it with your best friend, your for kids, their teachers, other
Mhm.
adults they trust, but it's important that you take your own mental well-being seriously. And if you're struggling with it in any kind of way, you should talk to a healthcare provider. You can be your primary care
Yep.
doctor,
Primary
but
care.
definitely have a conversation with someone about it. For young people, if you're feeling distressed, identify at least one adult you can trust that you can talk to about what you're experiencing, and help is available.
Definitely. Awesome. Thank you so much, Dr. Ben. So, Journey to Joy Live. I'm always talking about joy. My name is Joy. And I feel like everybody can experience joy despite what they've been through. What's your journey to joy been like? Your own joy.
Well, you know what? I think not prioritized enough. Okay. But as I get older, and my son reminds me I'm getting older. And so I think that things that I used to take for granted, like being able to just go out and take a walk in green space, just to have a little bit of time myself, walking my dog, things like that. Like I look for opportunities to find joy multiple times a day in all my activities, and I'm really working to prioritize doing the things that give me joy, which I think is really important. And I
Awesome.
would say to your listeners, try to start doing that early, but I think it should definitely be a focus of everybody's life.
For sure. Well, I really do appreciate you. I don't want to take up too much more of your time, your busy schedule. Is there anything else that you wanted to share or where people can find you if you want to be found?
Well, I so you can always find me at the Children's Hospital of
Yeah.
Philadelphia. Actually, you just find me on the internet. But I want to
Right.
thank you for doing this because I think the education piece and just opening up these conversations is so
Mhm.
important for our community. And so I applaud you and thank you for providing this opportunity to have this conversation.
Thank you, and you're welcome.